Hi, so my name is Sadim, and I thought now during this break that it's basically the best idea and best time to kind of record the video. And basically, I wanted to talk about it's not an idea, it's actually what I'm doing as my line of work since I'm working already as a marketing and account executive in EU Formatics. The company is basically a Finnish company which is specializing in the bioinformatics software, and I've been talking that in all the emails, and it's kind of like I'm kind of expanding and reflecting upon that. And it's basically the main thing is that the challenge or the concept itself is that it's an international business. But again, if you go and look at the customer profiles, they are a very high professional level niche of experts where they're doing already very intricate work, as they are molecular geneticists, and then there's the bioinformaticians who are basically then using the software and kind of making it easier and like kind of making the pipeline itself easy so that it can be accessible for those molecular geneticists to do their analysis and basically read the patient data so that they can make then a clinical decision along with the physicians and what kind of drug therapy that needs to be used. So they're practically busy. We need to know that whoever we are talking to, they are already on a very high educational level of what they are doing and what they have experience with, especially that our part is only on the dry lab part. When there is, if you talk about the NGS, it's actually next generation sequencing in two parts, which is the wet lab, where there is basically the lab work, the molecular biology techniques, and kind of this making sure that the DNA is very concentrated in a way that then there is the machine on the sequencer, where then the sequencer machine you can easily sequence the data, and then from there you then get it from basically a wet lab to just a file format, where this file format already have all the whole genome, or for example let's say the whole exome of the patient, where then we need to check like on this file format, which is basically a computer readable format, from the FASTQ file to the BAM file, then to the VCF. And I'm saying that when we get this data file, then this is becomes our work, like that the file format, the computer readable format, this is our work, where we then try to kind of extract the data and kind of make it very simple, that we put it into the software, and we're trying to kind of change the file format so that we can easily then manipulate the data and then kind of start looking at the genes and then how it's working. As in, that is actually the quality of the file format, or the quality basically when the people were doing this lab work in the wet lab, were they actually doing their work fine or not, and then is the data quality of this file, like, is it really good or not, or there is something missing here, or they did not do proper extraction of the DNA, and then the sequencer didn't read the whole genome but actually just read part of it, and then the other part where it was supposed to be having the variant or the gene mutation, it's not there anymore. And then it kind of then becomes that, okay, we need then to basically do some quality check and this quality control, and then tell those high educational profile people that they have done a mistake, and or that they need to kind of improve their quality, and then start to convince them that we have already the software tools, which is very easy. It's gonna automatize the whole process of your their NGS workflow, and then they can just easily find basically the solution to their problem in finding the gene mutation, and then kind of solving the patient problem with the drug therapy. So this is basically kind of my line of work, and then kind of my concept and idea, and then those many challenges that I'm trying to face, so that I can hopefully contribute to the healthcare sector and kind of get to help and do a social impact for all the patients out there with rare diseases and tumors that really need more care and more studies and research to help them overcome their own health problems. Thank you very much.